originally, our work was performed in triple-negative breast cancer, particularly focusing on a well-known aggressive subtype of breast cancer called basal-like. And the intent back then was to try to develop a simple single gene marker for diagnosing basal-like breast cancer in the clinic. And we were successful in identifying that marker as FOXC1 at a certain very high level of expression as being very characteristic and diagnostic of the basal-like breast cancer subtype. Subsequently, what we found is that in addition to being an accurate diagnostic biomarker for basal-like subtype of breast cancer, what the marker is actually capturing is an aggressive subset of almost any cancer that it has been tested in thus far. So far, in 17 solid cancers and some liquid cancers as well, like AML and lymphoma, this marker typically is diagnosing an aggressive subset of cancer, which typically metastasizes earlier than usual, meaning before it reaches necessarily a very large tumor size or tumor burden. Typically has a propensity for metastasizing to the brain and lung rather than to liver or other organs or like bone. So there's a preferential organic dissemination propensity. And third, these cancers are typically resistant to certain chemotherapeutics and certain other drugs, like certain immunotherapies or certain targeted therapies. So that's how the work morphed from originating in the breast cancer domain. And gradually, as our understanding grew from the work of our lab and others across the world, this really seems to be a biomarker which will find application in a host of cancer situations and scenarios in the clinic.